bone pain is a sensation of discomfort or pain that people with certain metabolic bone disease they feel in their bones. How do they usually experience this pain? So if you want to feel it, so one way to understand how it feels is a tap on your bone, on the wrist bone. So the kind of feeling you get of throbbing pain. So that is what is bone pain actually. So bone pains can be due to several conditions. Basically, bone is composed of two components. One component is a matrix, another component is a mineral. So mineral is basically like the cement, and the matrix is like the iron rods. So whenever you look at a concrete building, you'll have iron rods, and then the cement which is poured onto the iron rods in order to create a concrete structure. So our bone is also very similar to that. So whenever the concrete is deficient, that is the calcium and phosphorus is deficient, so then you can have bone pains, and it can also happen if there is some metastasis to the bone, or if cancer is affecting the bone. For example, certain hematological malignancies like multiple myeloma, they can also affect the bone actually. So even in that condition, you can have a bone pain. We evaluate patients with, first of all, we'll assess whether the pain is arising from the bone or muscle or some other structure. So by taking a detailed history. So typically bone pains are not present when the patient is completely at rest. If they turn, for example, if there is extensive bone pain, when they turn the bed also they can have pain. Or if they sit up from the bed also, they can have pain in severe cases. Largely, bone pains will aggravate the physical activity and improve with rest. So this is typical of bone pain. So once you are sure that the patient is having bone pain, we get a fundamental set of 4 tests which are essential to assess. We get a calcium, blood serum calcium, we get a phosphorus, alkaline phosphatase and albumin. So all these 4 parameters will be helpful in identifying what is the source of the bone pain. Vitamin D is an essential vitamin. It's a steroid hormone, and also it's an essential vitamin because it is not produced naturally in most individuals unless they are exposed to sunlight, adequate sunlight. It is not present in the food that we eat basically. And once somebody has vitamin D deficiency, they need to do, apart from lifestyle modification, they need to be on supplements basically. So these supplements are basically oral vitamin D supplements. So they come in 2 forms. One form is 60,000 IU of vitamin D3 which is available in India, and another form is 2,000 IU vitamin D which is also available. The 60,000 IU vitamin D has to be taken on a weekly basis for 6 to 8 weeks, and after that on a monthly basis. This you need to do it under the prescription of a physician or an endocrinologist or orthopedic surgeon. So that is how we treat vitamin D deficiency. We can also take 2000 IU vitamin D daily in order to treat vitamin D deficiency. There can be a lot of things which you can do in terms of lifestyle. One is to make sure that you have adequate sun exposure. So you need to go out in the sun with your entire arm and legs, if possible, exposed, and without using a sunscreen between the times of 11 and 2 p.m. The best way to achieve this will be to do some outdoor activity at least 2 to 3 days a week. Say on the weekends when you're free, you can go out in the sun after lunch for a walk actually. So even 15 to 20 minutes of exposure to sun 3 to 4 times a week will be sufficient to produce vitamin D adequately.